From what?
So from sex.
Okay.
Or ejaculation.
Okay.
And so basically 2 to 7 days period.
All right.
And best scenarios, you should do it in the lab.
Okay.
Now, some people are not so comfortable because obviously there are some labs which, I mean, the environment is not so conducive for you to, you know what I mean, ejaculate. So if your house is close to the lab, then you should make sure you get to the lab within an hour.
Okay.
Yes, because that is very important. So if the sample is submitted, there are certain basic things that we look out for.
Okay.
There are
Doc,
some.
if I may just slow you down a bit. So you are presenting a sample of semen.
Exactly.
All right. You're saying that the procedure involves you abstaining from sex at least 2 to 5 days prior to giving or, this sample.
Absolutely.
Okay. If you did it at home, I know, you're a urologist, but what, are you collecting it in what kind of content? Is there anything that you must not do generally?
So you'll be given a container.
You'll be given a
and
specimen container, right?
Yeah, yes, and make sure you collect it and then keep it very close to your body temperature as possible.
Okay.
But within 1 hour, get it to the lab
Okay.
for it to be analyzed.
Right.
Otherwise, you may have the spermatozoa, especially dying.
Okay.
Those things are very, very sensitive.
Right. Best case scenario, do the collection at the facility.
At a facility.
Okay.
Some facility try to make the environment so cozy.
All right.
And user-friendly.
Okay.
Others, and some people are so conscious of the environment.
So it won't happen.
Sorry.
So it won't
I
happen.
know of patients who try so much and then nothing comes out.
Didn't.
Yeah.
All right.
Unless what sometimes helps the process is when they bring their spouses along.
Oh.
To help with the process.
Okay.
One patient told me that when they were getting to the room, at the back of their mind, they thought everybody was looking at them. That these people they are going to ejaculate.
Okay. So then let's move forward. The sample is collected.
Yes.
Right.
Submitted.
Okay.
There are some key things we look out for.
Great.
The volume.
Okay.
The volume is one. The pH. pH has to do with the acidity
of the sample. Right.
And then we'll look at the count.
Okay.
The count.
Volume is how much you presented.
Exactly.
In that, can I say ejaculate? Right?
Yes.
Okay.
Yes.
So you've ejaculated. You are interested in how much I was able one ejaculation to give you.
Yes, because that speaks volume. That gives us a lot of interpretation.
I want my listeners to understand volume.
Yes.
So how much? Okay.
So it shouldn't be less than 2 cc.
All right.
2 milliliters.
Okay.
Yeah.
So even from that indicator,
we can draw a lot of interpretations.
We can say, hey, Iswa.
Yes.
Right. Okay. Yeah. Right. And then you said pH.
pH, the acidity.
Acidity of the sample you have given.
Yes.
All right. Why is that important?
So the semen is slightly alkaline.
Okay.
And rightly so, because the vaginal environment is acidic.
Okay.
So you need something that would kind of neutralize that hostile environment.
Chemistry. Balancing of equations. Yeah, I hated that stuff. Yes. Right. So there has to be.
Yes.
Right.
Yes.
That.
So if you have the pH being too low, or let's say the semen being too acidic.
All right.
It's an indicator that there's something wrong within the prostate.
Okay.
Yeah.
Right.
Or there's, an duct obstruction.
Okay. Just a sec, though. So if you've just joined us, folks, this is Ultimate Health on Joy 99.7 FM. We've been doing a series trying to help folks who want to have a child. We call it Conception 2025. And we've gone through a lot. We started with Dr. Paddy Ayete, consultant obstetrician gynecologist. We handed over the baton to Dr. Tobo, who is a urologist, consultant urologist, because, of course, justifiably, the focus is on women, what's happening to them, but men play a part. It takes two to tango, Absolutely. Right? So we've been looking at the male equivalent of preconception consultation, where you tell a practitioner, a health professional, of your intention to have a child, all right? Intention, desire, wish, right? and then they check you out to make sure you are in good standing. Okay, I'm not playing on the word standing when it comes to men, but you are in good standing, right? So that's why we have the urologist in the studio, okay? And we're going through wrapping up on that. If you have any questions, concerns, WhatsApp is 055 11 11 997. We're on Facebook, YouTube, and X. Alongside the consultant urologist, I've brought his twin brother, who is a cardiologist. Something just about them. But Wing Commander Dr. Benjamin Tobo is a consultant cardiologist. He also specializes in aviation medicine, right? And these two, somebody says, the doctors in your studio were brilliant terrorists on what do you know? What do you know? I'll come to my WhatsApp. So I brought him in because we do know that hypertension, if it exists or if you suffer from it, also has an impact on fertility, conception, and later downstream, even the pregnancy itself. So he'll be giving us, he's here alongside his school prefect brother in his SRC Gab to also give us that side of it. If you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. So that's what we're doing today. I'll do the WhatsApp in a bit. So, okay. So the pH, the acidity of the sample,
yes,
is important.
It's very, very important.
These sound like preliminary indicators. You've got the sample, the volume, the quantity is one thing. Yes. Then you are, the acidity is telling us something else.
Yes.
Right. And then what else?
So I looked at the one side of the pH, which is the acidity.
Okay.
But when you flip it to the other side, if it is too alkaline,
right,
that means you're having something like prostatic infection.
Okay.
Going on, and that has to be dealt with.
All right.
Then the other parameters, we spoke about the count.
Just a sec again, Doc. So the acidity is already telling you whether something is going on with your body.
Exactly.
Right? And it will show, it has footprints in your semen.
Yes.
Okay. Right.
So just to add to that, so if it is too alkaline, and there are indicators that probably there's some infection, sometimes you may see some white blood cells, and that may warrant that the semen is cultured at the same time, with the analysis. Right. Yes, so that's the usefulness
all this is happening
pH.
In the lab?
Yes.
Okay.
Within the lab.
This is part of the semen analysis?
Yes.
Okay. Right.
So the count is the main thing. That's what most people, are conversant with. And you have the commonest situation where the count is low.
Okay.
What we call oligospermia.
All right. Again, Doc, slow down for my listeners. Volume low, count, right? In this, statement or scenario, when you say the count is low, before you get to the oligo and all that, what is low? Okay. It's not quantity anymore, right? So you're looking at something, another parameter.
Yes.
So let's share that.
So we are looking at the quantity of spermatozoa.
Okay.
Within the specimen collected.
So we're counting sperms.
We are counting them.
They are countable.
Fortunately, you are not the one. It is not counted manually. So
but they are countable.
They are countable,
all
yes.
Right, good.
And they are in millions. They are millions.
Okay.
So the usual, we look at it in terms of concentration.
All right.
So the number of spermatozoa per milliliter.
Okay.
The number per milliliter. So if you want to get the absolute count, then you multiply it by the volume.
Okay.
So usually the normal concentration should be about 15 million sperms per milliliter.
In that one ejaculate, if I can call it that.
Yes.
There should be 50 million. 15.
Yes.
15 million.
Sperms per milliliter.
Which you say is the normal range.
Normal concentration.
Normal count.
So if you want the absolute count,
right,
you multiply the concentration by the volume. Yes.
Okay.
Yes. So you may be getting 30, 40 and above million sperms.
Okay.
Per ejaculate.
That is not overvoting? That small ballot box.
It makes it more probable for you to have a pregnancy.
So you need
it's all about
many,
the numbers.
And you want just one to meet an egg.
Yes.
And sort things out.
It's a struggle of the fetus. Survival of the fetus.
Right. Let me come back to this pink sheet again. So you have 15 million per
meal.
Per meal. All right. Okay. That is the overall of the count. Okay. It could be 50 million dead sperm. It's still a count, or?
Yes, sir.
Right. So we are counting sperm.
Everything. We are counting everything before we break it down.
Before we even get to those who can walk, those who can dance, those who can crawl. All right. Wow. Okay. Folks, bear with us. I need to do this with the returning officer, Dr. Bernard Tobo. Right. Okay. So 50 million. Right. That is a sperm count is extracted. Yes. We can get that. Determined. Okay.
Yes,
what's next?
So if we'll settle on the count for those who have low counts,
lower than this 15.
Yes.
All right.
There are probable reasons.
Okay.
The commonest has to do with collection issues. The people are missing their targets.
All right.
So they are not able to deposit everything into the container.
Okay.
So some may spill over. So that's one. Then some people, it could be a timing issue. You are supposed to abstain from sex or ejaculation for between 2 to 7 days.
Okay.
And some don't obey that rule. So when that happens, probably what may come out, may be less than expected.
Okay.
Yes.
Right.
So those are some of the issues. And of course, there are some other factors like infections, like what we call varicocele. Varicocele are dilated veins around the testicle.
Okay.
That can affect the amount of, the total count in the semen.
All that being said, then that tells me that from these initial indicators or parameters, you already will have in mind any further particulars or investigations you may want to pursue for this person.
Yes.
Right.
Further on.
Okay. All right, folks. So we're still at the polling station. All right. So we've been discussing semen analysis of your semen, its quality, its quantity, its acidity, alkalinity, and all those things. And you've just heard from my specialist in the studio, Dr. Bernard Tobo, that these are important parameters if you are seeking to get pregnant. All right. All other things we discussed last week still hold. Okay. If you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook, YouTube, and X. Shortly, in fact, I should activate the phone lines because he mentioned what was the varicoceles?
Yes.
Inflamed what?
So varicoceles, are in essence veins which are larger than usual.
All right.
So they are dilated.
Okay.
Yes. Veins take blood which contains impurities.
Okay.
Back to the heart, for recycling.
Okay.
So every organ essentially has, arterial supply.
Right.
That bring food and nutrients.
Okay.
And then when they are used up, the byproducts are sent back by the veins.
Okay.
So if you have those veins bigger than usual around the testicles, those impurities or waste products stick around.
All right.
And they damage or they don't help sperm production.
Okay, great stuff. Right. So my veins are 055 11 11 997. Those are WhatsApp veins. And then the big artery there is the the landline, which is 030 221 6541. You get to ask these two doctors questions, all right? And I was using the circulatory system to switch over to his twin brother because he's a cardiologist and that's his territory, right?
Yeah.
So you are with Gridco, right? Wing Commander Dr. Benjamin Tobo, you are welcome.
Thank you.
Right. Do you sneak up on your brother often, or this is the first time?
Oh, those were in times past.
Right. Great to have you. But yeah, respiratory conditions, hypertension, does it have an impact on our ability, the probability that we can conceive naturally and normally?
Oh, yes, they do. Because the whole business of conception involves having good quality sperms and good quality eggs.
Okay.
And all those have to be produced somewhere.
Okay.
And the production centers must be amply supplied by blood vessels that are in top shape.
Okay.
Unfortunately, conditions like hypertension damage blood vessels, especially when it's uncontrolled.
Right.
So if you have damaged supply of nutrients and food, like my brother said, then the factory will be in trouble.
Okay.
And so then the final output, which is the infertility issues, will start cropping up.
So what you're saying is that if Gridco, being the blood supply, is compromised, then the organs of the body
will face doomsor.
They'll face doomsor. All right. Will face doomsor, and therefore, be they ovaries or testes, right? They will be challenged.
Exactly.
Right? And this challenge can, should I say, move downstream in terms of their final product, be it eggs or sperm. So what you're saying is that if there is any problem with blood pressure, right, or the circulatory system, it affects both males and females.
Most definitely.
And therefore, it can affect fertility.
Yes.
Wow. Okay. So you've opened the door and brought the women back into the picture. All right. So let's continue. So if you have, and you said uncontrolled hypertension, so there are many people, we call it the silent killer. Many people are not aware they are hypertensive.
Not at all.
Okay.
In fact, when you look at the population of Ghana, from studies that have been done, about a quarter of Ghanaians are hypertensive.
Come on, don't say that.
That's roughly about 9 million people.
A quarter of the population.
Yes.
Wow.
That's about 9 million people are hypertensive. And when you just take that subset, only 1/3 know that
Are
they are
aware.
Yeah, are aware that they are hypertensive.
And of those who are aware, what percentage are on management?
22%.
Seriously. Wow. So
And only 6% have actually hit target.
so their management is in place, but it's yet to
It's not to
achieve
target.
its targets of, should I say, satisfactory control of their blood pressure.
Exactly.
Okay, so we haven't brought those who want to conceive into this 9 million. Okay, because the age spread and all that. So for persons who seek to conceive this 2025, their status with regard to hypertension is a key indicator.
Extremely.
Right.
Extremely.
So if you're listening to us right now and you have any family history or personal history of hypertension, and you bring it in later, but we know there's is it a twin, which is hypotension, right? But so what should you be thinking and doing?
Well, Ghanaians by nature or by practice, we are not our health-seeking behavior is not the best.
Oh, okay.
So one of the first things that you want to do is to know your status as to whether you are hypertensive or not.
Okay.
So regular health checks are very, very important. So that once you find yourself diagnosed with hypertension, then the next thing is to seek treatment.
Okay.
You know.
But Doc, you are a cardiologist. Your brother is a urologist. Okay, we are doing preconception consultation, right? Would a Ghanaian adult seeking to have a child typically present to a cardiologist and say, oh, by the way, I want to have a child, and can we have this conversation and do any necessary or requisite tests? Is it a normal, typical presentation that nobody will come to you, a cardiologist,
No, because
on account of wanting to have a child?
No. They will usually present to the where the primary, you need the urological system and then the gynecological system, they have to interplay.
Okay.
So we can have children. So when problems arise, it is during that initial visit to either the urologist or the gynecologist that the nurse, the attending nurse, will check their blood pressures.
Okay.
And blood pressure issues will then have them sent to the cardiologist.
Okay. Right. If they haven't indicated any desire, wish, intention to get pregnant or have a child, then we will be treating their respiratory or whatever condition they have. Right. So typically, so it's not too frightening if nobody comes to you and say, Wing Commander Dr. Tobo, I want to get pregnant. It's not too frightening. Or they should be, if they have hypertension and other issues, they should be discussing with you if they plan to get pregnant.
Yeah, once you are still in the childbearing age.
Okay.
And you are hypertensive, it is also of very, very key importance to us.
Okay.
Because some of the medications that we give to control the blood pressure may not be conducive for pregnancy.
Okay.
Because of the effects on the developing baby.
Right.
So once you express the desire to have a baby, then we'll have to switch to baby-friendly hypertensive medications.
Right. Okay. So if you are hypertensive and on treatment, and you desire to get pregnant, your provider should know, so that they can now modify your prescriptions or whatever is being used to control your hypertension. Right.
Yes.
Sometimes, if I may chip in, you realize that I was saying last week that some people are pushed to the wall before getting through to you.
Right.
One typical example of what hypertension can cause, it can weaken your erection.
Oh, yes.
Yes. So when the man can have, normal parameters or what have you, but he cannot deliver.
All right.
He cannot.
So here we are talking potency, not fertility. Right?
Both can be linked.
Both are linked. But
Yes.
I mean, when you say erection, then potency.
Yes.
The ability to achieve and maintain an erection sufficient,
Yes.
right, to do the job.
Exactly.
Okay.
So that is where the cardiologist may come in, because say, if you come to me and you cannot, bring out your semen,
Right.
i.e. the erection is very weak, then we have to look at the underlying factors.
Okay.
And the hypertension has to be dealt with.
Wow.
Yeah.
Okay, folks, 44 minutes past the hour of 2 on Ultimate Health. Joy 99.7 FM. Yes, my month is here. It's called Febuary, right? And we are on fire. Okay, we're still doing preconception consultation for men. We're still doing conception 2025 and equipping you with all the information that you should have should you want to get pregnant. If you're having challenges, this information is also relevant. This information is also relevant if you are undergoing any of the assisted reproductive technology or therapies or interventions. Okay, we need to know all these things. Last week, Dr. Bernard told us that, hey, if you're a man and you go to the doctor,
Yes.
Bernard,
yes.
I thought I made a mistake. Okay, and he'll ask you, by the way, what is your goal average, assists and all that? Yes, you need to tell him these things. It might sound sensitive, or hey, what's this guy getting up to? Okay, he's trying to see whether you are a midfielder, a striker, a defender, a goalkeeper. He still has to assess that. If you have any questions, my phone line is active 030-221-6541. I'll take a breather to read some of your messages which have been piling up. Okay, earlier we spoke to a lovely lady, friend of the program, who through some assistance of ours and her own prayers and many other things came together, has had ultimate twins. Yes, we spoke to her. Yeah, great stuff. The two doctors in your studio were brilliant terrorists on the platform in the late 90s with the veteran. Okay, I remember them very well. Congrats, guys. This one says, where am I now? Dede in Maryland. Okay, what's her issue today? Is the 2cc equivalent to an ejaculation? Are all ejaculations the same volume, or does it vary? Who's collecting, Dede? I'll pass that to Doc. Abstain from sex 7 days. Hey, does it mean? Hang on. Dede, it says abstain from sex in 7 days or for 7 days. Don't men pass semen when urinating or taking a piss? If yes, does that affect the sperm buildup and the collection? All right. Dede is interested in what goes into that test tube. Nortey, good program as always. I'm so happy. This is who now? Come on. Fred in Oibi. Scroll down. Where did he start? Okay. Benjamin Bernard, and we are proud of you. Kudos, Nortey. Those of us who were in secondary school in the 80s and 90s were fond or have fond memories of these super brains. They made us sit joyfully by the radio in school on Sundays. For what do you know? I'm just saying the parents that gave birth to these twins have blessed this country. I'm so happy they didn't leave the shores of the country to work. God bless them. May they give birth to super brilliant humans for our country. All right. Kudos, Nortey. This is Fred in Oyibi. All right. What do you know comes in? Scroll. Good afternoon. My name is Nanayao. I want to contribute to the show. I would hope for the services of an IVF in getting my twins. Okay, he's already decided. Can I get the doctors or the hospital where they could help me? Okay, Nanaya, I'll take your details and then we can see how to assist you. Right? He definitely wants twins. Okay. I know somebody wanted twins and got triplets. Yeah, more than a handful. Right. This one says, Doc, I've been married for about 11 years, but no issue. We have been to many fertility clinics for assistance, but to no avail. The last clinic I visited, the doctor said I have an issue with the movement or motility of my sperm. I asked whether there's a treatment. His response was not positive. Please, can I get an assistance from your end with regards to treatment? Okay, I'll let my docs respond, but I will also get in touch with you. All right, let me read a few more. My lines are WhatsApp is very fertile today. Good day, everyone. I'm 38 years now, and I want to know the quick steps to be able to conceive. Okay, or pentem. And would you recommend a fertility facility? Miss P. Okay, Miss P, keep listening. We will break this series to accommodate other things. The cervical cancer is coming up. Dr. Jifade and her people are coming up with their stuff as well. But yes, we'll be doing a lot on this. We want more Ultimate Health babies. Okay. This is from Abna. What does it say? Just listen to you talk about alkalinity and other condition of sperms. I want to know, is there a risk in swallowing sperms? Abna? Hey, but that's why I brought them into the studio. Abna, it's a great question.
There's no risk.
She's swallowing acid. Took your time. Doc, I haven't called you yet. Abna and I are talking. Abna, you are spot on. Will it affect your your teeth or anything else? Doc will answer. He will definitely answer. He cannot dodge. How are you, Dr. Bernard? Please, I would like to know, apart from pregnancy, which sperm perform? What work does the body use it for? Do the sperms have any other business? This sounds like one of the questions at vetting.
A sperm is either a cell of destiny.
All right.
So it has one in particular role. It does that job and that's it.
Okay. It's like asking if bullets do anything else. Good afternoon, Nortey. Congratulations to Ata Mami. Welcome to my home. Oye in Afienya. Oye, do you know whether it is safe to swallow sperm? Abna wants to know, but we'll get answers. I think I've cleared. No. Wow, I got married to what do you know? No, hang on. Wow, got married to what do you know those days for the Tobos, Cephas Riafi, the hunter from Koforidua, amongst others. Bravo. This is from Moses Daute in Tema. All right. Was Moses also on what do you know? The name sounds familiar. Okay, right. But he was married to the program, the show, because of you guys. Why do we still have it? Is it still on?
Oh, yeah.
Yeah, it is. Okay. Good afternoon. I'm called Abraham from. No. I get stray messages, and I'm not too sure. I think they are for Samson on the other side. Okay. Samson has the law program on the other side. So
right,
some of the messages come here. Good afternoon, please. I remember them. Oh boy. When they started the quiz program. Okay. That has nothing to do with conception. All right. Hi, Nortey. I would like to know which hospital to reach the doctor for consultation. Right. These are broad fertility consultations people are looking for. Kweku in Accra. All right. Let me come back into the studio. So, can we swallow sperm? Is it okay?
So semen, that's what we're talking about.
Will I have fertilization in my throat?
Not at all.
Is that also ectopic?
So generally speaking, swallowing semen is not harmful because it's made up of protein, enzymes, good micronutrients.
So it's a good meal.
However, the thing to consider is if it is coming from somebody with an STI.
Okay.
So somebody who has HIV, for instance. Once you've got in contact with that body fluids, then naturally you're going to get, you're going to contract an STI.
Know who you're with.
Exactly.
And their profile.
Exactly.
Okay.
But generally, there's nothing wrong with it.
So basically, you're emphasizing and underscoring safe sex.
Exactly.
Okay. Right.
Then somebody talked about the 2cc ejaculate.
Is it? Yeah.
Yeah, so I spoke about it being more than 2cc.
Okay.
So there can be variations. Everything depends on, the number of days you abstain.
Okay.
And you can get good volume. Once it is more than 2cc, we can work with it.
Okay. When you urinate, are you throwing away sperm?
No, you are not.
Please convince Dede for me.
No.
You are not throwing away sperm.
The only situation where that scenario may apply is if you have what we call retrograde ejaculation, where the semen goes into the bladder.
Into the bladder.
And that's common with those with diabetes.
Okay.
Some retroviral or HIV patients.
Okay.
And those who have nerve problems, spine problems.
Okay.
So, but for the general public, no, we're not doing so.
All right. Okay, great stuff.
Then,
yeah, go ahead.
I think somebody spoke about the movement, the motility.
Yes, the motility of the sperm.
Yes. So that's one of the parameters we look out for.
He was told by the doctor that his sperm don't move that well.
Yes.
Right? He's having challenges and he's asking. He said he asked the doctor if that can be remedied. He says the response was not positive.
I mean, we should be... See, when we find these abnormalities within the semen analysis profile, you go digging out for what could be the reason. And common things are always common. The infections and the varicocele, which is the enlarged veins around the testicle that I spoke about. And then sometimes the hot environments around the genitals.
Okay.
For very good reasons, the genitals are where they are.
Right.
Because the temperatures are kind of 5 degrees less than the body temperature.
Okay.
So if you expose yourself to more heat, those who use hot tubs, saunas, those who wear briefs which are very tight and dark instead of cotton and white, or work in very hot environment. I remember one client who was a ship engineer. The moment he went on leave, his semen analysis profile improved.
Wow.
So hot environments in general doesn't help.
Right.
Then toxins in pesticides, heavy metal. I mean, those who do galamsey, for instance, they are going to have fertility problems in future.
Over time.
It's not over time. It's not yet documented, but that's some of the things we foresee in those who deal with that. Yeah.
Okay. Right. I have a weak erection, and because of that, I'm not able to take any serious girlfriend. And for that matter, I'm not married yet. I'm 50 years old. Where can I get good help? I am Kwabena at Akuse. Doc, Benjamin, I was coming to you because, of course, erection is blood, right? It's, the heart is pumping blood to facilitate that erection. He says he has a weak erection. He's not getting it sorted out. And some people also complain that their meds for hypertension also affect the erection. So sometimes they toss a coin between the two, erection or pressure control. What can you say to this chap who says he's having challenges with the erection? I think also that secondary to that, psychologically, he's already lost the fight before he goes into battle. But let's look at the physiological part.
Yeah, like you said, so the psychological aspect is very important because that's the most powerful organ for even having the whole sexual experience is the brain. And then before we dive into what is causing his weak erection, we need to sit the person down and talk to the person, ask a lot of questions because we need to know whether it is an organic problem with the erection machinery, or it is secondary to something distant like hypertension. So it involves both consulting the urologist and then the cardiologist in that aspect.
All right.
Then once we settle on what is causing it and if it can be managed, then you have his relief. And then for those who are hypertensive and are on antihypertensives and it's causing problems with erectile function, I mean, there are solutions to it, so that you can still be on antihypertensive medication and still have a very good
so that you don't have to toss a coin.
Not at all.
Maybe Wednesdays for my medication.
Oh yes, I had a client like that who
Fridays.
5 days before action he stops his medication.
Oh wow.
And so he came to my echo lab where I had to look at his heart, and his heart is very hypertensive.
Okay.
And he had to confess that this is what he had been doing.
Right.
So I had to tell him there's no need for him to do that.
Some of the women, if you can't, they say all sorts of things, though, Doc.
But
somebody has sent me a message that I'm excited about ejaculation. Can you imagine? I'm just making sure you hear what I say. So, Doc, this thing, I want to enjoy sex, but I'm on medication. So I skip and hold the medication so I can enjoy the sex, right? And you are saying what? I should come to you for permission, or I should come to you so that you modify the medication, the prescription?
When you see the urologist, there are medications in their department.
The plumber first.
That can help with the sexual experience.
But the Viagra, Cialis, they also push up the pressure on the heart, don't they?
No, they don't. On the contrary, they rather bring it down.
They are safer methods.
Yes. And to add to what he said, I mean, there are good medications right now for hypertension.
Right.
Whose side effect profile on the erection is not like those in the past.
All right.
Yeah. So
we are blessed.
Maybe you may be starting with one which may give you those side effects.
All right.
You get to the specialist, they may switch you to another.
Okay. Yeah. Great. You should be seeing the right people and listening to the right program.
That's the point.
Okay. I'm not selling anything. I'm just saying see the right people and listen to the right radio programs. Good afternoon, sir. A lady in my area is suffering from fibroid and her stomach is looking more like a pregnant woman. She wants to talk to the doctor, producer of air. So if you can kindly leave the phone number here so she can contact you. Okay, we have a number and a name. We'll see what plumbing and connections we can do. But just quickly, we're almost out of time. Doc Benjamin, right? I have to be careful when I'm asking the questions now. But we know it also affects blood pressure. Can also affect ovulation. Yeah, we didn't speak directly, but can you quickly say a word on that? Though we said it can affect the organs.
Yes, like I said earlier, blood vessels are very vulnerable to uncontrolled hypertension.
Okay.
So once they get damaged, the blood supply to any structure in the body, including the ovary and the ovary setup, are also affected. And it's not only just the ovaries themselves, but the blood supply to the ovaries also.
Right.
So the eggs and their maintenance, because they develop whilst the baby is in the womb.
Okay.
And by the time the baby is born, the eggs are ready to be fertilized.
Okay.
But you just wait till the person is at the childbearing age.
Right.
So during that long period of waiting, if the blood supply gets compromised, then the quality or the safety of the eggs themselves will be in trouble.
Okay.
And then delivery of the necessary hormones and nutrients to the eggs in order to bring out good quality eggs at the right time.
So it can also upset hormones.
Exactly.
All right. Wow. Good afternoon, please. I want to know the days and time you always have this program. Sunday, 2:05, we are live. Okay. So don't miss it. This is called Ultimate Health on Joy 99.7 FM. I initially saw that I enjoy it, I was wondering what the person had typed, but it was about the program. Doc, thanks for responding to my query, but you didn't talk about where there is treatment, because I'm doing a series, okay, and I've noted your message and your number. All right. Sometimes I try to assist, but I try to make sure we're making the appropriate, well-informed referral. Okay. And sometimes even the person sending the message is going to now dilute my response 3 times before it gets to somebody. So I'm very, very careful when I say I will assist people or I will get in touch. Okay, so it's noted. Thank you. Wow, there's still more. Thanks. Where can I get a urologist to consult? I don't want to consult a general practitioner. This is about the gentleman talking about weak erection. Doc Bernard.
You can call the producer later.
All right. Okay. I shall get you a plumber. All right. I love it when we're so helpful and we get results. Okay. Have I cleared? Hey, Ziggy, are you sending me more messages or they are still flowing? Oh, goodness. This one says, good afternoon. I remember them very well. Okay. Yeah. Okay. What do you know, people? Charlie, the what do you know? I'll start what do you know here. So that we'll graduate them to quiz masters. This is Dede in Maryland. What does it say? She's done with the abstention. Change pressure meds to that of baby-friendly meds. Would that have to do with the dosage? All right. We said if you were planning to get pregnant, your medications would have to be appropriate. And the doctor said something. Can you just quickly talk about that?
Yes, baby-friendly basically it's not only about dosage, but about the type.
Yeah.
Antihypertensive medications are in different classes, about 7 different classes of medications. Not all are good for developing pregnancies. Okay. So the ones that are safe are the ones that are prescribed for women who are desirous of conceiving.
Okay, right. This one is asking about products recommended for improving sperm count and motility. I don't want to mention the brands he's put up there, but Doc, are there people taking things to enhance sperm morphology, motility, the sperm quality?
Yes, so we will recommend these products after complete assessment.
Right.
So we wouldn't advise you to go to the pharmacy.
Okay.
And just because somebody is taking this product, you also want to take it.
Okay.
So you come, we assess it fully. If it is something that will not require surgery,
okay,
and will require some of these medications, the specialist would recommend it appropriately.
All right. So you don't just walk into a pharmacy or anywhere else and buy something, swallow, chew.
No.
So what about these women walking around, all those barks and roots and all those things, and they have all sorts of rhymes and things they use to sell their stuff. Do you come across these, and are they doing anything good?
The advice that we'll give to our population, is to see the right specialist for you to be assessed. Some of these things may work, but it could be circumstantial, and then some of these products too will have deleterious effects on your kidneys, your liver, and all that. So see a specialist.
And the person selling you that in the lorry station or whatever, on your bus or wherever, we can't trace them. We don't know what they've given you.
At all.
Exactly. And more importantly, you yourself may not know your health status.
Yes.
As you patronize and consume these things.
They are very convincing as well.
Right.
So you should just be careful.
Okay. I have a what do you know question for the I don't know. Do tiger nuts come in anyway?
Absolutely.
They do.
So as part of lifestyle modifications,
nuts are good.
Nuts are good.
If you want
nuts are good for your nuts.
Now they are talking at the same time. Oh. Listeners, please come and say they are talking at the same time twice. Please.
So he just gave the interesting rhyme. Nuts are good for your nuts.
Pun intended. Nuts are good for your nuts.
Is that how you eat the twice of you? I'll never bring the two of you again. So come back.
So nuts in general, berries, the green, leafy vegetables, the onions.
They are good for what?
I say foods which are down to earth, closer to nature.
They are good for
what? They are
what?
good for your general health.
Okay.
And also specifically for your fertility health. And
really?
For your potency as well.
Okay.
Yes.
You heard him. You saw his voice breaking somewhere along the line. the man, it's been great. We've gone 6 minutes past the hour of 15. Ziggy, I bully him small, but when things are flowing or standing, he's quite happy to let me. But hey, Bernard and Benjamin, this has been a pleasure. Right?
Yeah.
So do you guys meet like this, like on shows, work-wise, professionally? You are in different directions, huh?
Oh, we have occasions where we intersect from time to time.
Okay.
Mostly at church.
At church?
Yes.
All right. Are you also into the ministry kind of? He was lay.
Yeah, we are all in the same boat.
Lay preach. What do I call you? Sophos or what? No. Men of God, men of...
So we all have a paper in theology.
All right.
Yes. Oh. And we are ordained elders of the Church of
Pentecost. We are ordained elders.
Yes.
Oh,
yes.
Okay. I need to mind my language sometimes. But it's been great to have the two of you, and we'll see how we can link you up. We've got quite a lot of people who want help. Okay, I don't want it to be some mass thing that people go and say now before you realize my phone number is all over the place. But we want to do the proper thing with those who do have concerns. Those who are okay, we give them the green light. They will do their stuff anyway. But those who need to do specific, deliberate things and interventions and have treatments and management, we want to direct them to the right places and make sure, okay? Folks, if you've been listening to me, please, this is targeted at those in committed, serious relationships. Don't go producing by height, anywhere, everywhere, and then running away. Last week, I think, was it Hayford in Battle? He says, what accounts for the anxiety when, even though you've been struggling for years, when you suddenly are successful, then there's anxiety? It's because... It's because you know that the person you succeeded with perhaps is not the one you wanted to have children with, and so on and so forth. So we are talking about people who are in committed, serious relationships. Okay? So stick and stay on Joy 99.7 FM. My name is Nortey by nature, produced by Ziggy, by Bedu. And we'll be back next week with some more interesting stuff for you. Stick and stay.
All right.
Everybody.